Welcome to today's Community Health Talk. These slides contain important safety information for the products. As with all medical procedures, there are some risks. Please visit the Axonics website for more information and remember to bring all those important questions to your appointment with your physician.
Hello, everyone. My name is Stephanie Jacobs, and I'm going to be talking today specifically about a device called sacral nerve neuromodulation, which is one of the treatment options available for a condition called overactive bladder. And just as a quick side note, there is a full, more in-depth conversation about all the treatments for overactive bladder that is also on our website, but wanted to really have a shorter presentation here focusing on sacral nerve neuromodulation specifically. So with that in mind, I just wanted to review how much some of these conditions that impact patients' lives can have. So really focusing on bladder as well as bowel symptoms that can be disruptive to patients' lives. So conditions like overactive bladder make patients have to constantly stop on trips, miss part of shows, or worry that they can't find a bathroom nearby. And just backing up a little bit, overactive bladder specifically is a condition that includes urinary frequency, urinary urgency, times where women or men can't make it to the bathroom, or urgency incontinence. And these conditions are not necessarily a normal part of getting older. They're not a part of just being a woman, or for men having an issue with the prostate, or caused by something that patients did wrong. They can, however, have a big impact on our quality of life. So again, patients often talk about limiting participation in physical exercise or activities, changing their social interactions and plans, having an impact on their overall sense of self, causing depression, on relationships related to sexual health with partners, their jobs, and even just all of the different things that impact having to cope with these conditions, like wearing pads or diapers or having special bedding. And again, patients are not alone, which is something that we really want to emphasize and then kind of move into how common this really is. Overactive bladder impacts more than 50 million people throughout the United States. And there are also almost 20 million who suffer from bowel leakage, accidental bowel leakage, or fecal incontinence as well. So going through a little bit more of why this happens. So really the bladder should have a pretty simple function. It should store urine and it should effectively empty urine. However, with overactive bladder, this doesn't function normally. There can be missignaling between the bladder and the brain, and that can result again in urinary frequency, urgency, or even times where patients can't make it to the bathroom fast enough. But again, there are treatments that can be helpful. Some of these treatments, just to briefly talk about, can include things like medications or lifestyle changes. However, we do know that patients who start a medication have a very high rate of discontinuing that medication within a year. There can be advanced therapies beyond things like medications. And again, while things like intravesical Botox or bladder Botox and an ankle stimulator exist, I'm going to focus this talk a little bit more on the option of sacral nerve neuromodulation. Specifically, this is the sacral nerve neuromodulation that is made by the Axonics company. So what is that therapy? So it's a therapy that is designed, it modulates signals to a nerve in the pelvis, and it's designed for the treatment of overactive bladder, which again is that urgency, frequency, or urgency incontinence, and can actually be used for urinary retention or fecal incontinence as well. How does it work? So all of these conditions could be caused by abnormal communications that go between the bladder and the brain and the bowel. Axonics therapy gently stimulates one of the nerves in the pelvis that impacts these organs in our body. And by doing so, can actually help restore normal communication. So when we think of what sacral nerve neuromodulation consists of, it really simply is a wire and a battery that are ultimately implanted together in the pelvis. The wire is put in a form of a trial, and that can be done either in the office or in the operating room setting. And if that trial is successful, it is ultimately hooked up to an implanted battery that goes underneath the skin. Everything at that point is underneath the skin in the patient's pelvis. And after a successful trial, really the device is very discreet and not something other people can notice on the patient. There are two different battery choices, both of which are very small and have different pluses and minuses to them. One is a very tiny rechargeable battery that can last for approximately 20 or more years. And one is a non-rechargeable battery that patients can really set on autopilot that lasts between 10 to 20 years. Again, both are very small devices and easy for patients to manage. Patients can control the level of stimulation as well as help with getting notifications for when the device needs to be recharged. And really, this therapy has come a long way in how it has become much more easy for patients to manage on their own and to assess on their own. It also gives patients feedback on if they have a rechargeable battery, when that needs to be taken care of. Some of the things that we get asked frequently about the device in general is whether or not it's safe with this type of implanted device to have an MRI. And the Axonics device is MRI compatible for the 1.5T and 3T full body scans. Generally speaking, it is a very impactful therapy for many of our patients. More than 93% will have clinically significant improvements in their incontinence at 2 years. About over 90% of patients were satisfied with their results at 2 years when we look at studies of these therapies. And 94% were satisfied with the Axonics therapy, and 93% would go through this therapy again when looking at many of the initial pivotal trials. Really, sacral nerve neuromodulation can be a great option for many patients. This is a brief overview of the therapy that we hope to have on our website that can be accessible for our patients as well as potential new patients, and really just to provide information and hopefully make the therapy seem less overwhelming and provide a little bit more insight on what it can involve. Thank you, and this is our office information for any old patients who have questions or would like to discuss this further, and as a resource for anybody else in the community.